Welcome everyone to our Lunch and Learn today. We're very excited to have Dr. Patrick Long with us, and I'm going to go ahead and let him introduce himself. Thank you, Patrick.
Wonderful. Well, thank you so much for the introduction. My name is Patrick Long. I'm a geneticist. I have a private genetics practice in downtown Denver that is focused on adults with undiagnosed or diagnosed genetic disorders or hereditary disorders. And I am here today to discuss a little bit about some kind of updates and just the context of genetic testing in autism, as well as genetic testing for other neurodevelopmental differences that we see. So just some things that I hope the audience can take away from today's talk is I'd like to review the definition of autism, intellectual disability, and neurodevelopmental delay. Identify some important principles for or related to the genetic evaluation and genetic testing in autism and intellectual and developmental disorders. And then hopefully enhance the awareness around the benefit of genetic testing in autism and intellectual and developmental disorders. Just a little bit about me. I am originally from Michigan. I actually had a very early interest in genetics in my undergrad, and that really influenced, my decision to kind of pursue medicine. And subsequently, I did a family medicine residency program. So I'm also a family doctor. After I finished that residency program, I came out here to Colorado at the Children's Hospital of Colorado and spent 3 years there. I spent 2 years doing a genetics residency where we'd see lots of kids with neurodevelopmental differences and order testing on them, and stayed on for another year for kind of a more specialized subspecialty of genetics called inborn errors of metabolism or inherited metabolic disorders. Once I finished all my training, I saw a huge need for adults and genetic testing or just clinical genetic services for adults in general, and started the private practice, and it's called Sequence MD. So shifting gears here a little bit, just want to start off with the introduction of kind of how the American Academy of Pediatrics defines autism. So autism spectrum disorder is a developmental disorder that affects communication, behavior, social interaction, and it's characterized by a wide range of different symptoms and abilities, and these can vary widely, both in function and kind of clinical actionability. Children, obviously, with autism can, present early with difficulties or differences in social skills. They can exhibit repetitive behaviors and so show some challenges related to verbal and nonverbal communication. And some children, autism, it's an umbrella, a very broad kind of term or label. But it has real important impacts as far as coverage and access to early intervention services. So it has a very important clinical role. But there's a lot of different ways that we can kind of subdivide or think about autism. And, a lot of children that present, with autism, sometimes they have other features like intellectual disabilities. They could have developmental disorders. They could even have things like epilepsy or differences in the way that their body was formed. And they can also have very typical or above average intelligence. So autism is a very broad kind of category of things that, gives us a lot of opportunity to break it down into more specific or subcategorize it. The American Academy of Pediatrics really emphasize early identification of autism. It's so important to be able to identify it so that we can connect folks, families, patients with appropriate services to maximize their potential and help provide them with adaptive or assistive devices or approaches to life and school and learning and social interactions. Um, Intellectual disability, the AAP defines intellectual disability as significant limitations, both intellectual functioning, so learning, reasoning, problem solving, adapting and growing kind of normally and being able to, live independently, safely. And they part of the definition includes that this has to be present before the age of 18. So this is congenital, something that a lot of times they're born with. And we know based on, the amount of testing that we've done with kids with neurodevelopmental differences, there's a very high diagnostic yield. So, some depends on the literature that you look at, but up to 40% of folks with neurodevelopmental differences, including autism, intellectual disability, developmental delay, up to 40% of patients with that have an identifiable single gene mutation that elucidates the cause of this. Intellectual functioning can be assessed using standardized tests, and it could be also characterized or qualified, using social, conceptual, or practical skills, and just seeing how kind of the child functions in their day-to-day life. And the range of intellectual disability is broad. It can range all the way from mild to profound. And this can drastically affect an individual's ability to live independently, or if they need a little bit of supervision, or if they need full-time kind of round-the-clock care. And again, it's very important to identify these so that we can intervene early and maximize the child's potential. Lastly, developmental disorders. The AAP defines neurodevelopmental disorders as a group of conditions that emerge during, the critical period of development. So walking, talking, social interaction, all those kind of typical development. Any kind of delays in that or inability to kind of reach that certain developmental milestone, or in some cases even reaching that developmental milestone, but then kind of regressing and losing some of those skills.
Want more bacon?
Pardon?
You want more hungry?
Neurodevelopmental disorders can lead to a lot of difficulties in motor, language, speech, social interaction, learning, cognitive reasoning. And neurodevelopmental disorders are very broad. They're kind of, as broad or even kind of more broad than autism, but they include autism, ADHD, intellectual disability, and specific learning or communication disorders. And the AAP says, really emphasize that these conditions are early. They're kind of defined by a developmental disorder, so they have to present early on during that developmental period. And they tend to persist in some way or another throughout a person's life. And just like the autism and intellectual disability, early identification and intervention is critical to maximize their potential. So I see a lot of folks with intellectual and neurodevelopmental disorders, but I also see a lot of patients for a lot of other things. We think there's somewhere between 8,000 to 10,000 single gene disorders out there. They're very, very rare individually, but collectively they are thought to affect around 5% of the general population. And these are things that can onset in adulthood or in adolescence. I would say, a third are going to present in the neonatal period, a third are going to present in childhood, and another third are going to present in adolescence, early adulthood, or in some cases even late adulthood. But in general, when I see a patient that gets referred to me, and I see patients that are really, these are outliers. These are outliers in any kind of sense of the term. These are generally patients who've had lots of testing or for whatever reason have been identified by their pediatrician, their primary care doctor, their neurologist, their cardiologist as having some feature that is not commonly encountered in that specialty or by that practice or that clinician. And they usually reach out to me when they say, hey, this is a little bit of a different case than I usually deal with. Will you have a look at them? And when I see these patients, I'm always thinking about these red flags, and I always communicate these red flags to my referring partners and colleagues and to folks like you guys, because I think there's not enough knowledge out there about how to recognize a potential genetic disorder or even how to think about it. But these are just some of the real general red flags that I kind of think about. So symmetric or multi-system involvement. And what I mean by that is if we do a brain MRI or brain imaging and we see both sides of the brain have certain features or have signs on them that are symmetric and on both sides, it could be also the kidneys or the lungs or the limbs, anything that's symmetric or involves multiple organ systems is definitely a red flag for potential genetic disorder. Obviously, family history of a genetic disorder goes without saying. A lot of these genetic disorders are inherited, but really, most of the neurodevelopmental disorders are not typically inherited and can just be due to random mutations that occur. So we don't always rely on family history. The absence of it doesn't rule it out, but the presence of it should make you take a second look. When I see kids should never really have chronic disease. So it's pretty straightforward with kids. If they have a lot of chronic disease or a lot of problems early on, and it's not well explained by a birth history or anything else, it's definitely genetic till proven otherwise. But for adults, it gets a little more complicated. Adults have a lot of time to accumulate injuries, to age, and just the toll of life. But I'm always asking myself, does this person's disease, is it disproportionate to their risk factors? So, things like smoking, obesity, diet, exercise, age. Is their disease consistent with what I would expect for somebody with their risk factors, or is it disproportionate? Or do they appear to have disease, but it's earlier onset and they don't have those classic risk factors? A lot of genetic disorders mimic other more common diseases. So like a nerve problem in people that have diabetes. Well, a lot of times that's the frame of reference that a lot of doctors have. However, what's really important is that we have standard therapies and treatments for that. And if those symptoms or those signs don't resolve with the standard therapies, we need to rethink or revisit the accuracy of the diagnosis that we're working on and start to broaden our differential diagnosis or possible medical diagnoses that are causing this. A lot of my patients have seen lots of doctors, had lots of testing, and either the testing is unusual, I should say atypical or unexpected, or it doesn't show anything clearly identifiable. But the patient is clinically presenting with a lot of very suspicious features. So a lot of genetic disorders, there's not an easy way to diagnose them other than genetic testing. I think anytime you have individuals who have very remarkable or disproportionate or unique clinical presentations, always want to consider genetic. And then any malformations or differences in the way that the body or the anatomy formed and developed should be considered as a cause in that. Genetic disorders, most of them affect multiple organ systems, and they can evolve over time, or they can kind of stay stable. It just really depends on the disorder. But that's really, kind of a hallmark of genetic disorders, is that a lot of the patients that I see have a lot of different diagnoses, and there's nothing unifying all of those different symptoms or abnormal findings on exam or their clinical history. There's no single unifying thing, but there's enough kind of breadcrumbs to kind of start to put together a picture, and that's really where genetics thrives, and genetic testing can be so helpful for developing, elucidating the cause and helping to inform patients and families what to expect, and gives us the ability to be more proactive and be more intentional in how we diagnose, manage, and treat folks with genetic disorders. So when I see a patient, and this is really kind of going to be primarily, tailored or kind of through the lens of an autism. It's really important, what I spend about 60 to 90 minutes with my patients. I do very detailed review of their medical history, their previous specialty evaluations, their primary care notes, their lab testing, their imaging studies. And I'm going through that, and I'm documenting and kind of collecting and organizing it in a way that helps me think and helps me come up with a strategy and approach for testing. And genetic testing is it does have, it's important that you get good medical history, and we call it phenotyping in the specialty of genetics. It's really important that we get very, very detailed and very complete histories and a physical exam, because it really does improve the sensitivity or likelihood of finding a diagnosis when we do genetic testing. Sometimes we will do a behavioral or developmental assessment. The ones I do are very brief relative to the more formalized developmental assessments, but both are very helpful in giving us clues. And then once I've got all this information and I've examined them, I'll take a look at it, and we'll come up with a testing strategy. We may recommend, just one or two genes. We may recommend one test, or we may recommend a broad test. Yeah. Where the American College of Medical Genetics stands in around, I think it was 2021, they released a practice kind of guideline that recommended broad genetic testing. So when I say broad genetic testing, I mean testing all of the genes, or typically thousands of genes associated with the known neurodevelopmental disorders, of which there's thousands of them. And then we will collect the sample. The testing, can take some time. It can take anywhere from 4 weeks to 12 weeks. And when we do get those results, we do meet with them, and we have a pretty detailed discussion if it's positive and identifies a cause of this patient's difficulties with learning, or neurodevelopmental delays or regressions, or really any of the features that I've identified during the medical intake and physical exam. So when we do genetic testing, genetics is interesting. Everybody has a kind of a different, we're all exposed to it in various ways, whether it's through the media or 23andMe, or we have a family member with a genetic disorder. Everybody kind of comes at it from a different perspective, but I kind of try to break it up in these two general approaches. I do diagnostic testing. So I see folks who have a well-defined medical history, so they have multiple diagnoses. These are not healthy folks. Typically, I shouldn't say they're not healthy. These are not folks who don't have any medical problems. These are folks who have multiple medical problems that I'm seeing. And we can take kind of two approaches. We can take a gene panel approach, or a whole exome or genome. That's kind of that broad, untargeted approach. So with multi-gene panels, let's use the example of a patient that I see that didn't start walking till maybe 4 years old, maybe started speaking around the age of 3, and they also have seizures. Well, in that case, I want to test for neurodevelopmental disorders, and I also want to test for seizure disorders. Depending on the lab that you use, there might be a seizure gene panel with 300 genes, and there might be a neurodevelopmental disorder panel with 700 genes. Some folks, usually non-geneticists, like to order panels. It kind of limits the amount of information that they get back, and sometimes non-geneticists have some hesitation in ordering testing because they don't quite know how to do genetic counseling or kind of talk to the patient about things to expect prior to testing, or things to think about. But they also have some difficulty sometimes interpreting the results. So sometimes they like to do multi-gene panels in the hope that it kind of limits or kind of controls the scope of their discussion. I think that whole genome and whole exome or untargeted approaches are really the most sensitive, so it gives us the highest likelihood of getting an answer. And it's a really powerful test that really lets us analyze all the genes in a person's out of their 22,000 genes that they have. So it's a very, very comprehensive test. It's really our best genetic test that's available at this time. It's also helpful because if we don't get an answer, we can feel pretty confident that we've maximized our testing options, and that at this point in time, we don't have an answer. However, that may change in the future. And the data that we use, it doesn't go stale. We can continue to analyze it every year because we make hundreds of new gene disease discoveries every year, and we always want to keep up to date with things. So there's a lot of benefits of a whole genome approach versus a gene panel testing approach, particularly among neurodevelopmental differences, including autism or intellectual disability. So historically, genetic testing really the minimum standard of care, which I think if you were to ask a lot of geneticists is a little outdated. But for anybody with any neurodevelopmental differences, at minimum, a chromosome microarray is recommended. A chromosome microarray is different than whole genome or gene panel. A chromosome microarray, it tests the amount of genetic material. So it's not reading the genes or sequencing it. It's really just telling us, are there any areas of the genes of the genome that are deleted, or are there any areas that are duplicated? Is there too much or too little genetic material? That's probably it is a very outdated perspective, but that's the minimum recommendations that are currently out for genetic testing. This is a very dynamic area. Genetics is moving so quick that over time, our testing has improved to the point where most gene panels and whole genome testing, it does the same work as a chromosome microarray, but it gives us access to thousands of other genetic disorders that we wouldn't be able to see just using a chromosome microarray. Because over the last 10 years, we've started to use whole genome and whole exome, and it's really standard of practice in children that have any neurodevelopmental differences. Has just been a surge in the number of new and the number of identified patients with single gene disorders associated with neurodevelopmental conditions. So there are a lot of kids out there, and we know there's really high diagnostic yield. Unfortunately, these same tests are not widely applied in adults if you're over the age of 18. You know, having a neurodevelopmental disorder, intellectual disability, or autism, it's not life-limiting. People can live full, long, healthy lives with this. And just because they were born, 10 years earlier than, a kid born now, that they wouldn't be offered genetic testing doesn't really feel ethically right. It feels like we should be offering adults who present with neurodevelopmental differences the same degree of testing that we are offering and is really widely the standard of practice and care for children that are presenting with neurodevelopmental differences. A lot of questions come up around insurance coverage and payment. The diagnosis of autism, intellectual disability, neurodevelopmental delay is a very powerful diagnosis. It's well recognized and regarded by Medicare, Medicaid, commercial insurance, and the evidence and data is exceptionally strong and really well established at this point that if somebody has a diagnosis of intellectual disability, developmental delay, or autism, 9 times out of 10, genetic testing will be covered for them, and really broad genetic testing will be covered for them. Now, every insurance is different, every state's different, every policy's a little different. We tried to do our best, and the labs are very generous with patient assistance programs, and very few of my patients really, probably in the single digits, haven't been able to get testing due to financial difficulties and or insurance denial. So it's really a rare case where folks are not able to access genetic testing. And this is really regardless of their age. And I really make it a point to really advocate for patients. And if need be, I'm happy to discuss with the insurance company. And most of the time they come around when I talk to them. So a lot of questions I get, well, why do this testing? What's the benefit? What's the purpose of this? Like I alluded to earlier, genetic disorders can affect multiple organs. And if we're just kind of clinically treating and waiting for things to happen, you're kind of on edge. You never know what's next. And furthermore, you don't have any direction on how to appropriately manage and treat this. When we do genetic testing and we identify a single gene that we've shown in hundreds of other kids across the world, that when there's a mutation or there's a misspelling or an error in that gene, it kind of opens up a whole world of literature and practice guidelines related to that gene related disorder. So it really takes a very obscure and sometimes complex clinical picture, and in the matter of a single test and a couple of weeks to process that test, we're able to take this really complicated case and we're able to really break it down, and we're able to understand all the history and explain all the past medical history, explain all the problems that are going on at this moment, but also look forward to the future and have some ability to anticipate and provide a prognosis for families of like, okay, are these seizures going to get better? Do they respond well to certain medications? Is there a risk that I'm going to have another child with this? What does the evidence show about certain types of behavioral or therapeutic interventions that we do? This type of approach works really well for this group of gene-related disorders. Or is this something that's going to get worse? Is this going to, having a genetic diagnosis really provides all of the detail and information that we need to really do a really great job for caring for these folks. And I think having the genetic diagnosis is so specific. It's a strong diagnosis to justify, lifelong access to resources and support, whether that's, family and like kind of advocacy groups of like this gene related disorder. You might be able to connect with hundreds of other family members. And our families are experts on these disorders. They spend 99% of the time with them, and they know about these disorders better than most doctors out there. So there's a lot of value for families being able to meet other families and have that shared experience. But it also really helps us understand these diseases and kind of build our knowledge around each gene-related disorder. And really, insurance companies, these are things that nobody has any control over. They're not there. We have all the tools. We have so many resources and abilities and therapies to help folks. We really, by having a genetic diagnosis, really helps to enhance and be very intentional and targeted with our interventions so that we maximize the benefit of them. So I kind of have alluded to this before, there can just be, pure autism, high functioning, they do well, but there's just some social differences. And then there can be autism with other things. They can have muscle problems, nerve problems, they can have seizures, they could have not only autism, but they could have some developmental delays or developmental regression. They might also, a lot of these disorders, as I've kind of mentioned several times, there can be other features. They can have kidney problems. They can have skeletal differences. They can be at risk for heart problems in the future. Getting a genetic diagnosis really lets us peel back the curtain and look into a crystal ball and really tell us what is going on and what to expect for this person throughout their whole life. And our knowledge is imperfect, right? Most of our patients are kids, again, because we just haven't been offering this to adults. I think it's so important that we test adults for the same things that we're testing kids for, because so many families out there, yeah, maybe they get maybe they get offered genetic testing and their 3-year-old gets diagnosed with this genetic neurodevelopmental disorder with some autistic features. She might be the oldest person that we know of with this diagnosis, but there's no indication that it's going to be life limiting and that they're not going to be able to reach adulthood. So there's almost certainly adults out there, whether they're in group homes, whether they live with parents or a caregiver, there's almost certainly an adult out there with that genetic disorder. And it would be so great if we were able to test them, because it would give us a little bit of a window and insight into what's the natural history of how this gene-related neurodevelopmental disorder progresses as somebody moves through life. Are there other risks that we haven't considered? Like maybe in middle age, they have a higher risk of developing cancers, or maybe they have a period in midlife where they have regression in their cognition or skills. So helpful, and it really helps families and patients prepare and really builds our very much dynamic and growing knowledge around these thousands of single gene related disorders associated with neurodevelopmental differences. It's also extremely helpful, you know, for family history and being able to make really much more informed reproductive decisions. And so just to kind of recap the talk so far, I hope that I was able to give just a real general overview of kind of autism, neurodevelopmental differences, and intellectual disability. Kind of what that looks like from my perspective as a practicing clinical geneticist, and kind of how we approach that. But also I hope that you walk away with this, or at least conveyed that, you know, genetic testing for these conditions is absolutely clinically indicated. It's widely done and really standard of care in pediatrics, but these are conditions that are not going to self-resolve when you turn 18, nor are they associated with a significantly shortened lifespan. So my broad general overall arching goal here is that I hope that more adults with these conditions are able to advocate for themselves, their families are able to advocate for them, and ask their primary doctors or their other doctors, you know, if they think that they should see a geneticist, or that, you know, have they ever considered doing genetic testing like they would in a kid who has similar features. This is a really new and exciting area, and I hope that I hope that this talk was helpful to kind of introduce things. I'm not a developmental specialist by any means. I work with a lot of them, but I have seen close to 200 folks with these conditions, and I've diagnosed almost 50% of them with the single gene disorder, and it's very transformative and very impactful to the family. You know, they finally feel like they have gotten an answer, and they finally feel like they can get ahead of things instead of waiting for things to just fall on their lap, and then kind of just dealing with it in a very kind of untargeted or capricious way. We now have these tests that can really enhance the care and just provide so much more actionable insight to continue to take great care of these folks even into adulthood. Thank you for all of your attention. I would love to answer any questions that anybody has. This is my contact information and location for the clinical practice that I have. I work with 2 genetic counselors and a physician assistant, and we have some office staff. We accept all insurances, and try to make it a really welcoming and safe and comfortable environment for all of our patients.
people from Arizona want to work with you, how does that work?
I'm licensed in Arizona, and I think that this group of disorders, intellectual disability, neurodevelopmental disorders, autism, are very amenable to virtual visits. I can get a ton of information just from chart review and talking to the patient. What it all comes down to is what is the most prominent feature that's presenting? And quite honestly, it's usually the autism, developmental delay, intellectual disability. That is like such a prominent feature that really all the other pieces help to kind of fill in the picture and really help us to interpret any results that do come back. But I do think that this group of conditions is very amendable to virtual and telehealth. So I'm licensed there. I'm happy to see folks from Arizona by telehealth. So hope that the long-winded way of answering your question.
That's amazing. It's so cool. So fascinating, all of this. Anybody have any questions? You guys can come off mute or you can put them in the chat and I will read them for you, whatever feels best. I feel like we're just on the start of learning so much more about autism and so much I'm excited to be on the wave here.
I would agree, and 90% of the genetic testing that we've done has all been done in kids, right? And really pretty sick kids that are sick enough to get to like a major pediatric academic health center. There's a lot of inertia there, but the future is so bright for this group of folks. And I really want to just, raise awareness on just the value and importance of, and really the kind of justice aspect that we should really be doing. We should be offering the same degree and quality of testing regardless of your age. And so it's just, most geneticists are pediatricians. And the last time a lot of adult providers heard about genetics was probably when they were in medical school or training. So I'm out here, trying to sing the song and raise awareness, and I'm so thankful for having this opportunity to talk to you all.
Awesome. Somebody asked, do you accept AZ Medicaid plans?
The state Medicaid, no, but if it's something that is in ongoing discussions, and I think that well, I guess question for you, do you know how many of your members are on Arizona Medicaid? If you had to roughly guess.
I don't know. I don't, and I'll be honest, I'm not quite sure. So we have all techs here, which a huge portion of the autistic population. That's the Arizona long-term care, but I think that's different than the Medicaid, but I'm not quite sure. So
it is.
It's okay. Thank you.
So Altec is it is the Arizona long-term care plan. Medicaid is the access plans, like United Health Community Plan, Arizona Complete, Banner is another access plan. So I am a nurse case manager working with one of our local health care community providers.
I think
and most of ours are Arizona access.
I think getting a network with Medicaid, again, like most of my patients are on Medicaid or Medicare, and which, it's harder to have a genetic disorder. So I think it's definitely, my business partner is on this call, so we'll be talking about getting a network with Arizona Medicaid.
Okay, thank you so much for the information. I appreciate it. It's always nice to have more resources available. Most of the patients that I work with have Arizona Medicaid plans. There are some with commercial plans. You also accept commercial insurance?
Yep.
Okay.
Yep. We're a network with all the major commercial insurers, and I think we have a very fair, like, self-pay price. And like I said, these lab companies, these lab testing companies, they have their own contracts with all the different insurers, but they also have just incredibly generous financial assistance programs where, like, most of my patients do not have a out of pocket, and of the like 10% that do, it's usually not any more than like $200. So, we are very willing to work with folks if they're very motivated, if they want to be patient, give us, few months to kind of get things worked out over there. But I do think that Arizona, being so close, being the fact that I'm licensed there, it's definitely in the plan.
Thank you so much. I appreciate the information.
Thank you.
Awesome. Well, thank you so very much. It was great to have all this, and I'm excited to be able to share it with everyone. And thank you everyone for joining us. I'm going to stop the recording.